Hey everyone, welcome back to another episode of the Grow RDH podcast. I am still traveling, as you can see by my background. I am in my Airbnb still. If you haven't been here before, welcome. My name is Katie Pudwell and I'm a dental hygienist based out of South Dakota. And if you are a repeat listener, thank you as always for coming back. Normally, my podcasts have been designed for a hygienist, and today's no different. Today I want to discuss why hygienists are great, and so this is an episode for everyone. This is an episode for your patients, for your employers, and for you to, it's almost like a little love letter to hygienists, and just to remind you why you're important and why you make a difference and how far you've come to get where you are. I know that there's a lot of uncertainty in terms of scope of practice and expanded functions and all of these changing landscapes that make the employment culture and just the general environment sort of tumultuous. And this is designed to just sort of be a calming, hopefully, episode that does review some of the really important components of what a hygienist is. And so the title of this episode is I Am a Dental Hygienist. Dental hygienists are licensed healthcare professionals, right? And we focus and specialize on the prevention, treatment, and maintenance of periodontal diseases, but we also promote oral and overall wellness in many different aspects. Many times we're mistaken for other professions, right? A lot of times just the general public may not know the difference between an assistant or a hygienist. And sometimes people really don't understand what we do or where our expertise lies. So this podcast is for everyone to help spread the word about who we are and why we fill a need, not just in dentistry, but in the overall healthcare field as a whole. And so by the end of this episode, I'm hoping that I will make the case that the dental hygienist is the bridge between dentistry and the very wide world of healthcare. We fit into that healthcare landscape. And so first, I want to just talk about what it takes to become a dental hygienist. And I don't want to differentiate here between an associate's level and a bachelor's level, because I know that there's many, many really good associate's programs out there. I am teaching at an institution that offers a bachelor level only, but that does not diminish any of the associate's programs. There are many amazing programs that offer associate's degrees. And the reason why I don't want to differentiate is because in order to be accredited, to graduate from an accredited program, it's all the same, right? The differences between associates and bachelors go beyond the scope of like our clinical expertise, right? And so I don't want to differentiate. I want to discuss just accredited dental hygienists as a whole. And so in order to graduate from an accredited dental hygiene school, we have over 2,900 curriculum hours and over 600 clinical hours that it takes to graduate from an accredited program. Accreditation mandates a very rigorous course load. Those courses can include anatomy, physiology, nutrition, pharmacology, radiography, and extensive education in periodontology. Accreditation also requires clinical competence in many, many procedures, but the big ones, right, that set us apart: periodontal therapy, or what we used to call scaling and root planing. We still use those terms for insurance reimbursement purposes, but what we do is so not scaling and root planing anymore, right? We do periodontal therapy. We also are competent in local anesthesia, emergencies management, clinical assessments that help us get to a dental hygiene diagnosis. And those are just a few. Those are just a handful. There's many other clinical competencies that are required in order just to graduate from an accredited program. And so the academic rigor is intense, and accredited programs provide a very solid educational foundation. So that's the first part. Second, you need a license, and there are multiple steps very similar to the licensure required for other healthcare professionals. And as we get more into that interstate compact and more states are recognizing licenses from other states, I think it will become even more similar to other healthcare professions. But right now, we are a little bit different in that state-specific scopes of practice are very true. I mean, that's a landscape that's probably not going to change very quickly, but the licensure process is very similar. So once you've once you've graduated from an accredited program, dental hygienists have to take 2 different licensing exams. And the first exam is a written national board, just like the nurses take the NCLEX, right? It is a comprehensive exam, and it covers all of the sciences that we talked about that are included in that rigorous academic curriculum. It's comprehensive, and it covers all of the sciences. And in addition to that written exam, we also have to take a clinical exam, which sets us apart. That's different. Some other healthcare professions do not have to do that. The skills competence is done in the school, but not for dental hygiene or for dentistry. Once we graduate, we have to take a clinical exam as well. And depending on the region, the clinical exam is dependent on the state that you want to work. A lot of them are regional. This hands-on test evaluates the candidate's clinical skills. And third, most states require you to take a jurisprudence exam. And what this does is that it ensures that you understand the state's Practice Act and the scope of procedures that you can do within that state. So there are a lot of checks and balances that protect the public from dental providers who are not prepared or competent to provide adequate care. And that is the main requirements that it takes for a dental hygienist to get a license. The third thing is that once you have your license, you have to maintain it. And there are multiple things that we as hygienists do to maintain our license. In every state, dental hygienists have to take continuing education. And the purpose behind continuing education is to maintain our clinical skills and our knowledge. They learn new technology. They develop ongoing interpersonal skills, and those include communication techniques. We're constantly learning about how to better communicate with our patients, about clinical skills, again, different technologies that are coming out. The landscape of dental technology changes constantly, and there's always new things to learn. They monitor your oral health constantly, and they document changes over time. And the purpose behind that is to catch disease early and to treat disease appropriately. Dental hygienists learn and grow with their patients to support behavior change. This leads them into conversations about tobacco cessation or quitting tobacco, nutritional changes that might impact how their immune response is responding to their periodontal infections. They might even talk about stress management. Again, stress impacts our immune response, and dental hygienists are capable and aware and know how to talk about those behavior changes with their patient. What I think is unique about the dental hygienist, and I don't have statistics on this, but I am going to get there. I'm so interested in doing research on this, because if you think as a patient or as a healthcare professional, if you think about how much time you spend with your healthcare providers, I would venture to guess, and I am going to propose, that patients see their dental hygienist way more often than they see any other healthcare provider. If you think at the most basic level and you don't have periodontal involvement, you might see your hygienist 1 hour every 6 months. And if you think how often you might go in for an annual checkup and you see your doctor, you might see that doctor for 10 minutes a year, or that nurse for maybe 20, 30 minutes a year because you're going in annually. And your hygienist is different. You get to see them 2 hours a year at least. And some people who are more periodontally involved, or they have high risk for caries, cavities, they are going to go in more often. So even some of our periodontal maintenance patients, we're seeing them 1 hour every 3 months or every 4 months. We're looking at 3 to 4 hours a year spent with this patient, talking about health challenges, talking about health status and immune response and overall health and how it impacts the mouth. So I'm going to venture to say that we see our patients quite a bit often, more often than they're seeing their normal providers, their regular providers. You see your hygienist. If you're a patient, you probably see them more than any other healthcare provider. And what's important is that through that rigorous academic training and education, your hygienist is fully equipped to catch early systemic disease. And so your relationship with your hygienist is essential to overall health for many reasons. That means that when you disclose things about your personal life or your personal health or health challenges that you've been experiencing, they're equipped to handle that. Please be open with your hygienist. Please be honest about health concerns and risks that you want to address. Not only do you see your hygienist more often, but they are fully equipped and fully trained to discuss any health issue with you. And they're going to help you make connections. If you're a diabetic who's struggling to control their blood sugars, they can get you in touch with the right people, right? They can make those connections for you and work with you to make some really positive health changes that you want to make. So this is going to be a shorter one, but I just want to wrap things up. And I want to reiterate that a dental hygienist and becoming a dental hygienist requires a blend of rigorous education, extensive 600 plus hours of hands-on training, and a commitment to lifelong learning, right? It's a career that demands technical skill, precision, and a genuine desire to build relationships and help people maintain or reach optimum health. So my call to you as a patient and as a hygienist even is to help people understand and help people become more aware of what your hygienist can do for you and how you can work with your hygienist to really make some positive life change. Thank you for listening. If you've made it this far, I appreciate it. Thank you. Share this episode with patients. Share this episode with the hygienist that you're thinking of, your favorite hygienist, and let them know that you see them and you understand their career and you understand their profession, and just send them some love from me. So that's all today is about, is sending love to my hygienists out there and helping patients understand what you do. I hope you have a great week, and we will see you next episode on the Grow RDH podcast. Thanks.